Okay guys, what I want to do now is, for our next video, I'm going to continue on with the idea behind shoulder programming, shoulders functions, things like that. So today what I'm predominantly going to be talking about is more along the muscular anatomy of the shoulder. So really to do with considerations, concepts, ideas behind where we come up with solutions, from strengthening exercises to rehab exercises to reconditioning exercises, reprogramming and so forth. So a real true strong understanding of that muscular system and how the shoulder works and what goes into it is really important. Now, the first thing to think about with the shoulder is it is quite different to the rest of the joints. In that I mean, when we look at something like the hip or the knee, for example, it's quite straightforward. So you have your agonist and antagonist muscles, your muscles that do things, and you have your stabilizer muscles, the ones that set the joint, evenly dissipate force and so forth. Now, where the shoulder differs to the rest of them, it is kind of a 3 dimensions to it. So we have our normal stabilizer stuff. So you've got your rotator cuff, as an example, and you have your normal agonist antagonist. You've got your pecs and your posterior delts and posterior complex. But what's important to realize is the roles of the intrinsic versus extrinsic stabilizers. So I guess when we look at it is to really understand that role of the scapular muscles and how they shift roles depending on the position of the humerus. So whether they're agonist and antagonist creating powerful movements or forced movements versus stabilizers and setting muscles. So when we really look at the shoulder, we've really got to look at it in 3 distinct areas. So we've got to look at the muscles that deal with the humerus, we've got to look at the muscles that deal with the scapular, and we've got to look at the muscles that deal with the clavicle as well, which are normally overlooked and normally a very kind of stern, very strong kind of role in that stability, and more importantly a real important role in maintaining good movement mechanics, especially with throwing movements or anterior muscular dominant movements. So what we'll do is we'll take each one and we'll look at them a little bit closer. So when we do take the humerus as an example, okay, so we've got your anterior posterior complex, predominantly dealt with pec major, we've got anterior delt, pec minor included in there, and then you got your posterior complex. Yeah, so you've got your posterior delts, you've got your lats, you've got your triceps as well. Yeah, and then within there we've got our rotator cuffs. Yeah, so you got all your 4 rotator cuffs: infraspinatus, supraspinatus, subscap, and your teres minors. Now, the role within here is obviously humeral movement. So we've got your anterior complex, those pec majors, anterior delts, biceps, pec minors, and serratus. Now, really important that when we do think about these humeral movements, we also take into consideration plane of movements. Yeah, so if we think about retraction, protraction for a second, what we've got is we've got a very big role of pec minor, we've got a very big role of serratus anterior. Now it's really important to take this into consideration, the serratus anterior and its antagonist rhomboid. This is where we come across the first kind of real tricky part of dealing with the shoulders. So when we do deal with this protraction retraction portion of shoulder and humeral movement, serratus and rhomboids are agonist antagonists. So one pushes, the other pulls, one counterweights the other. Where it becomes tricky and something to really think about is when we shift the movement of the shoulder into more of an abduction position. This is where we see our first change. Here, serratus and rhomboids actually work together. They become synergists. This is our first example of a shifting in roles of the muscles, this 3-dimensional idea of what happens in the shoulder, which we don't really see in other joints. Because of this, it leads to worries, problems, and dysfunctions. It's this complexity of movement, this shifting of roles that we don't see in other joints. It has to be considered, and it's something that's overlooked a lot within programming. So we talk about, I've got anterior shoulder pain and so forth. We look at it from a very one-dimensional point of view. Oh, it's push-pull or it's weak to strong. Whereas this neurological balancing, this ability to shift muscle recruitment becomes really important. But anyway, sticking on this humeral movement for a moment, sticking in this protraction, retraction. So what we look for is we've got this pec minor, end ranges, serratus anterior, protraction across the body, rhomboid setting the scap from the back, and the role of pec major. So pec major in that abducted, internally rotated, or horizontal abduction in medial rotated position. Yeah, now when we come back into that protraction retraction area, this horizontal abduction adduction, and we also talk about posterior delts, we also talk about lats, we also talk about triceps in here. Yeah, now if we shift the plane of movement into this into this side abduction, adduction, yeah? So now we're bringing in the roles of more of the delt complex, anterior complex, posterior complex, medial delt into this role, yeah? So still setting into the humeral movements, still working with rotator cuffs, setting the humerus, yeah? So moving then through the musculatures as we work, and we are working through this push-pull, this protraction, retraction movements. It's really important to understand the role of pec major. We'll talk about that really quickly for a second. So pec major's role in here is, setting a horizontal adduction, yeah, and its internal rotation position. Yeah, now what we can find a lot of the time here is with humeral instability or lack of humeral control, and also a poor serratus anterior contraction, we become over dominant on this adduction position and this adduction role of pec major. Now what will normally happen is pec major along with sternal fibers overloads the humeral head, takes control, becomes really tight. It leads us to this kind of rolled position, this set anterior position. As a result, it can create a lot of internal or intramuscular weakness within the pecs itself. So within the pecs ourselves, we've got these sternal fibers and we've got these clavicular fibers. With this intramuscular weakness, it can lead to a lot of problems with clavicular stability and the clavicular fibers of pec major becoming weak and underactive. This can then in turn lead to clavicular instability. So this is what we were talking about at the beginning. So this clavicular instability leads to this kind of very anterior dropped position. Yeah, so we get this roll forward position, we get this over dominance of the sternal fibers, clavicle's not setting. As a result, because of the role of those clavicular fibers of pec major in kind of setting and hinging that clavicle, we get this drop position of the clavicle. It leads to a lot of this anterior kind of impingement problems, especially in pushing movements and this muscles that are too strong. Yeah, as a result, the entire shoulder and humeral, glenoid humeral joint becomes unstable. So as you can see, there's a real intricate role to these muscles. Its complexity is in the fact that there is multiple muscles working to bring about normal action. Okay, so it's like we talked about before. It's not the forces and the force loads that we need to be concerned about with the shoulder, as opposed to like with the hip, where it's large muscles generating large amounts of force, which create joint displacements and things like that. With the shoulder, the complexity is, and there's so many muscles working and using to accumulate to give us movement that dysfunctions and breakdown in one or two can have catastrophic effects in the entire action of the shoulder. And the problem with, again, is because there are so many different joints working and being worked by these muscles that you can have dysfunctions within, for example, here, these clavicular fibers, which may not necessarily be resolving or relating to humeral movement, but distinctly having effect on how well the humerus moves. So these things all need to be considered when we think about shoulder and shoulder actions and shoulder movements. Yeah. The other that we really need to look at is the role of this intrinsic, extrinsic stability of the shoulder. And when we look at the intrinsic stability of the shoulder and intrinsic stability of the scapula, we think about these the upper traps, mid traps, lower traps, rhomboids, and as I've said previously, the synergist role of the rhomboids and serratus. So we really got to take into consideration this action here when we talk about that side abduction, adduction. So as we go into abduction above the horizontal, it's the intrinsic role of those stabilizers, rhomboids and serratus, particularly in setting that lower apex or an inferior angle of the scapular to allow the shoulder to move. Because as we come above that horizontal, we become less reliant on the delt complex to move the humerus and more reliant on how well these muscles are shifting the scapula to get the AC out of the way to allow for smooth locomotive action of the shoulder. So one of the things in recapping that we really need to look at with the shoulders is kind of one of three things. The first is the amount of joints in the shoulder joint, and as a result, the amount of muscles responsible for moving those joints, the distinctions of differing stabilizer groups to agonist antagonist groups. The second is the varying role of these muscles, where these muscles will have multiple roles within their movement complexities. So where we have the same muscle generating an agonist-antagonist load versus a stabilizer role depending on the position of the joint. And thirdly, it's really important to understand that it's not about the strength of the muscles, but on their dynamicism, their ability to recruit, to do complex dynamic movements. When we think about shoulder, strengthening shoulder development, shoulder training programs, I guess that third one is probably one of the most important things. It's more important to teach complex dynamic neuromuscular coordination than it is to teach through and complete force development and strength development. This is where a lot of programs kind of go wrong, where we just load and load and load and load, and as a result what it does is it alienates a lot of these muscles. So we get a situation where we're just loading and loading and loading, and the big muscles, of which there's a few, but pec majors being one of them, respond very, very well to this training. But what it does is it creates huge imbalances with the smaller muscles that aren't able to keep up with that kind of load. It affects that complex dynamic movement patterning of the shoulder. It throws off that real locomotive, that synergist movement, that control the action between the varied stabilizer groups, the varied agonist-antagonist groups, and as a result it leads to dysfunction, poor force productions, poor movement dynamics, and essentially poor programming. So all these things we need to think about moving forward. So in our next couple of videos we'll talk about the dysfunctions that relate to problems within this area, but then also how we maximize our training programs and how we maximize exercise prescription to give us the best results possible. So thanks for watching, and we'll see you for the next video.